Like you can see here, it's swollen, so you want to make sure you retract the lid, so you're making sure you're getting all the way, so you're getting from that cap.
Hey everybody, welcome back to another episode by Dr. Vlad the Vet, yours truly. Before we get deep into this video here, I just want to emphasize that the surgical site was clipped, it was anesthetized, and it was cleaned before we started cutting. So the type of block that we use for this specific surgery is a 4-point block. I'll put a picture up here in the corner for you guys to see what type of block I'm talking about. And then we proceed by taking the eyelids and then going for the globe itself. The globe meaning the eyeball. In this case, the eye was pretty nasty, whether it was trauma, whether it was cancer, we don't know. And unfortunately, we did not send the eye away to determine the diagnosis. From what I could feel, it felt like a cancer eye. Some of the softer tissues, the muscles, once the globe was removed, had that firm feeling to them, which is a telltale sign that there was what we call squamous cell carcinoma involvement in this specific eye. So I just wanted to let you guys know I had to make the imaging black and white just so that YouTube wouldn't stop the video from being uploaded. Hopefully they don't delete it just because there still is a little bit of visualization in there, but I felt like it was a good educational video to post. So I hope you guys enjoy. As always, like, comment, share, subscribe, and I'm happy to be doing this and uploading more videos, so I appreciate everybody's support thus far. Thank you, and enjoy until the end. I'll probably be doing a little bit more voiceover in this video as well, just explaining what I'm doing, so hope you don't get tired of my voice.
Oh, there goes the eye. There's a gnarly abscess. Yeah. Clamp the nerve.
So what I'm going to be doing next is actually using a hemostat to clamp the back of the eye, and at the back of the eye we have what we call the optic nerve, the optic vein, and the optic artery. So that's essentially the highway that supplies the eye with its sensitization, its blood, and then returns the blood back as well. This is going to be the first time that I've done this during an eye enucleation surgery. When I first started, my suturing skills were not the fastest, of course, and I regret not putting hemostats just because without putting the hemostat, you definitely get a lot more blood coming from that artery. With this, you essentially add some constriction to that artery that's flowing. It allows less blood to pass through, obviously, and then allows you to work in a bit more comfortable of an environment with less blood coming out. So once I remove that eyeball, I then go back and I start working on the tissues. The biggest important note to take away from eye enucleations, especially in bovine, is that when you do remove the globe itself and then you go back into the orbit to remove the muscles, it's important to make sure that you suture it as quickly as possible just so that we get a clot forming within the orbit. So once that eye is removed, get those tissues out, close it up as fast as you can, get that clot to form in there, and once that clot's forming, then the bleeding will eventually stop.
Try to just clean up this extra tissue. No, it's over here. I took it off, but maybe I should have kept it. A lot of extra tissue. hard to... Oh, yeah? I'm always scared of going too far back. And then you can run into messing up the other eye, maybe. With the optic nerve. I'm happy with that. Maybe a little bit of... Take this tissue off, actually. Is that kind of abnormally? Yeah, it was hard. Yeah. But see, now I don't know what was due to the cancer, and I don't know what was due to the lidocaine, because you know when you inject lidocaine, it causes like the emphysema underneath the skin. So you'll see like this is really hard here, but that's probably because of the lidocaine rather than the cancer. So... Yeah, like it's here, it's impacting the bone already. Oh, man. Yeah. Yeah. Try and cut it out, but... Yeah, it's a little rough there on the bone.
So at this next step, we're finally going to move on to suturing. We like to close these eye enucleations in 2 layers, or essentially 2 lines of suture, not exactly 2 layers. So the first line is going to be a horizontal mattress line, and then the second line that Dr. Herb, an associate at our practice, is going to be doing is a simple continuous line. So here I'm doing the horizontal mattress, which is essentially 1 to 1.5 centimeters away from the eyelid margin that I cut. And then that allows us to have a nice pucker line to be able to do a simple continuous over that and just ensure that extra barrier, a nice line of closure, and ability for a good clot form to happen.
One on the neocampus, and then to the right, you'll feel that little roughening that's already started. Yeah. And now we just do a continuous horizontal mattress. I've never seen a continuous horizontal mattress. I didn't see it either. It's something Dr. Pereira showed me. Oh no. It'd be good if you had needle drivers that actually closed. Yeah. I think I figured out how you did with the double on the one side and the one on the other. I'll explain it. Needle drivers are garbage. Every single time I tell them we're getting new equipment, but they never do. And now that line is going to be loose. Okay, now it's your turn. So I'll start it for you and you just finish. No. Because this stuff is going to have to be removed in 3 weeks. So it's more cleaning up. Yeah, exactly. So I have that lip that was created. And I just... That lip, you said? Like, see these lips that I created on the horizontal mattress? Yeah. So I want a little bit deeper, actually. There we go. Exactly. No, he just likes it because it seems cleaner for him. So if you want, you can use your hands, you can use the forceps. So just grab, you can feel where that line is of suture. And And now you just grab 1 to 2 centimeters, so like this next one will start right here. Go all the way through across. Just pull that down. And then you just slowly keep doing that. Okay? Make it look nice. Action shots. Like what I do, you saw me, I went through and through, but what you can do is perfectly fine. Go through that first layer, open it up, and try and get a little deeper in on that upper eyelid, so you're not close to the incision. There you go. So you want to be on this side of the horizontal mattress, but let's say halfway between the tip of the eyelid and the horizontal mattress. Tail visual. Yeah. I think like that. Yeah. Perfect.
What we're going to be applying here is aluminum bandage spray. So we just add that as a barrier. It has some antibacterial effects, but also has some obviously bandage effects, is what it says in its name. And then the second spray is just going to be Catron IV, so to prevent flies, deters them from that surgical site where there is that blood. So that's going to be the end of this surgery. I hope you all enjoyed the video. As always, like, comment, share, subscribe, and until next time.